We might kick off. So my name's Sarah. I'm the coordinator of nursing for the Wangaratta, Benalla and Cobram campuses. And we've got Renuka here, and she's coordinator for Shepparton, Seymour and Echuca. First, I'd like to start by acknowledging the traditional owners of the land we're all meeting on. We're really lucky GoTAFE spans across a wide region, so we've got a diversity of traditional owners. So pay our respects to the elders past, present and emerging. We've got Kate Reid here with us today, who's one of our students at the Wangaratta campus. Now, Kate started in February 2021, which feels like a lifetime ago. She's gotten through a peak of COVID pandemic, and she's about to finish up her final placement in June or July. We will go through, ask Kate a few questions, just get some more information on what it's like to be a student at GoTAFE studying Diploma of Nursing. And following that, we will do a presentation just giving a bit more information about nursing. So Kate, I might put you hot and center of the screen for everyone to enjoy, and I'll just ask you some questions.
Thanks. That's actually in the center of my own screen. Oh, great.
Perfect. Kate, can you tell us a little bit about your experience at doing the Diploma of Nursing at GoTAFE?
My experience has been fabulous. So a lot better than what I thought it could ever be, to be honest. I think that you'll ask me more questions why I think that, but it's been a cohesive experience. I felt part of a team. I felt very connected, and I honestly didn't think that I'd make it this far.
Perfect. Now, I know I said just before that obviously you joined during the peak of the pandemic. What are some of the challenges that you've found, and what are some highlights that you've found you've been through coming and being at GoTAFE?
Going through COVID whilst trying to study, I obviously am a mature age student, so I haven't studied for quite a while. I think I finished year 12 20 years ago. So going back to studying was overwhelming. We went back on campus and then there were some lockdowns and we were remote learning. But to be honest, the theory side I struggled with the most, but the teachers supported me through that. So there was nothing that you couldn't ask them about that wouldn't help you by learning from home. We did lots of Zooms, we had lots of group chats, we were getting follow-up emails all the time. So it actually wasn't hard to navigate at all.
Perfect. Now, I know that you obviously decided to choose nursing a little bit later in your life. Can you tell us what motivated you to make the switch, and how has your transition been in studying nursing from your previous roles?
I started off I always wanted to be a nurse, but to be honest, I thought that the sight of blood would not be ideal for me. So I never went through with it after school. Everyone kept telling me that was a major component of nursing, was obviously the physical health side of things. But something later in life when I had children made me realise that what I was doing didn't feel like it was 100% what I wanted to be doing. And I didn't want to give that my all if I felt like there was still an itch there to explore. And I just Googled nursing, Wangaratta, and GoTAFE popped up and it was offered part-time. And I started to inquire and I just decided that it was time to do nursing.
Perfect. And can you tell us a little bit about your experience as a part-time student as opposed to being a full-time student?
Part-time, we have a business locally in Wangaratta, so that absorbs a lot of my time to do that. I've also, when I signed up in 2021, I had a 4-year-old and a 2-year-old, so life was pretty chaotic in my personal space. And then doing it part-time allowed me just to have some breathing space. I felt it was an extra 6 months, so I thought it would set me up for success rather than me feeling overwhelmed and having to potentially miss out on this opportunity.
Beautiful. And can you touch on your work-life balance? So obviously part-time, you only study on campus 2 days a week as opposed to the 3-day-a-week full-time component. Can you tell us about some strategies and tips that you have that helped with the demands of the course and managing your work-life balance?
Again, it wasn't just me that is responsible for achieving this outcome. I think working and being vulnerable with the assessors at the time of each subject, they would tell you what the assessment requirements were. You would go through it step by step. They help coach you as to what you might need to do or to start thinking about, and that there might be a lot of work involved. And I just used my TAFE days as that was when I was at TAFE, that's when I needed to do the content of my work. And then when I knocked off that, I went into my other roles of juggling the other balls of parenting and my other job commitments and things like that. So I found that working with the assessor and with my team, like in the class with the other students, helped me get to this point of the diploma.
Beautiful. And obviously the course requirements of being on campus, we have a 9 to 4 day. Do you do like much study outside of these hours? And can you talk us through that a little bit?
I feel like you being the coordinator, I should probably say that I do some outside of hours, but it's actually really quite achievable. I'm surprised because doing theory doesn't come naturally to me. I'm very practical, so I like to watch and learn. But the theory side of GoTape has been manageable. Sometimes you might decide to stay back in lunch break or break times and do the content that you've been given. I find that if I treat those days as my TAFE days and my schooling days, haven't had an overload of commitment of study.
Perfect. And managing a business, you also have secured employment in the industry. Is that right? Can you talk us through how that happened following your first 6 months of the course?
Yeah, I first started doing nursing. When I started studying it, we got this email out saying that the COVID clinic were looking for staff, and I thought there's no way possible that I would be remotely qualified to go and work in the health industry. I did. I went and worked at the COVID clinic down in Wangaratta in Tone Road, and I did swabbing, and it felt amazing. I actually felt like I was doing some sort of health profession, and I loved it. There's also been other students that have gone and done some PCA work, which is working with the aged care or working at the hospital as well. And that was all within their first year. So you're able to go and start working as soon as you sign up and start studying, essentially.
Beautiful. Awesome. So can you tell us about some of the resources and supports that GoTafe have that have helped you really succeed in your course?
Unfortunately, I just missed out on the portfolio day due to some other commitments, but there's been lots of insight through the assessors as well. Like they'll tell you what to go to, what to do, what to look for. The portfolio day was going to talk to you about the grad years that are available for student nurses coming out that are graduating. We went to a careers day as a group, which was really fun. So there's lots of different ways, like the assessors guide you as to where you go once you graduate, what to do.
Beautiful. Diploma of Nursing does have a practical placement component. Can you tell us a little bit about how this has prepared you for the real world nursing practice that we're so soon to see you in? And do you have any memorable experiences from placement that you'd like to share?
That's really funny because I ran into one of the assessor that taught my first subject for fundamentals was at the supermarket not long ago, and I ran into her and I made it known that she was the reason that I pursued nursing because she set us up for absolute success for placement. So we went through so much. There's 2 labs. We went through mouth baths, which I'd never heard of before until I started nursing. And to be honest, that's something that you do on placement. And she set us up really well.
Now, your placement is so soon. You're almost finished. What does the future look like for you? Where do you want to go with this nursing career?
I don't know. I'm excited to try everything, Sarah. I'm going to try not become too confident in one place. I hope to keep challenging myself and keep going into different fields until I feel like I keep making a difference in different areas. I haven't pigeonholed myself into one area that I want to go into. I don't know.
Wonderful. And do you have any advice for any of the potential students on the call with us here today about how to really succeed at GoTafe and consider what they want to get out of their nursing career?
Remember the purpose as to why you're doing it. So at times I've thought it's all been a little bit too hard with the young kids, but I'm really proud to show them that it's never too late to pursue a career that you want to do. The therapeutic nursing sides outweighed any blood that I might see on prac or on placement. So I love it, and I can't wait to be out there and learning more and working with like-minded people. So I say give it a go, and you've got absolutely nothing to lose. And going into the nursing diploma was daunting because it is a different language. I'm not used to any of the language that's spoken, but if you're vulnerable and you just let the assessors in on where you're struggling, they really help you a lot.
Might open up the floor to anyone who has any questions for Kate. Any potential students, you can pop it in the chat. Kate's happy to answer them while she's on the line.
Kate, I'd like to ask you a question.
Sure.
Did you find it TAFE when you were struggling a little bit with the language, and you hadn't been like at school for a long time? Was there any support services there that helped you that they could refer you to?
Definitely. There's always support available. And again, that went through, I know I keep saying this, but I lent on my assessors a lot for that. So I would tell them where I was struggling, and they would facilitate. It was like a olive tree. They would tell you as to what area to go to get help for that, whether it's referencing or medications or different terminology that you've never heard before. They would definitely help you along the way and guide you into the support centre through GoTAFE.
So GoTAFE,
at GoTAFE.
Great. So GoTAFE have got support
They do.
centres. Oh, that's really great. Thank you.
Hey, I've got another question. Just about your placements. How did you find them, and where were you located? Were you located locally, or did you have to travel for them, or how did that work?
The placement team did their best to try and keep us as close to our residential address as possible. My first placement was at Beechworth Health, and that was amazing. I've had really good placements so far. I went to district nursing at Cobram. I loved it. And then my last placement was at North East Health in Wangaratta, and that was fabulous, which is my hometown, which is where I am now. So my final placement will be at Benalla. So as far as placement is concerned, it's all been driving distance and very easy to manage.
And you've seen a variety of different settings.
Lots. Yeah, I have. I've seen, and I think the more you're willing to see and to learn, the more they expose you to. They when you're on placement, if you're eager and you show a passion for what you're doing, they will take you for the ride. They'll let you see as much as you can see.
Thank you.
Anyone got any other questions? Perfect. Well, there'll be plenty more opportunities to ask questions along the way. And if you have any after, we can let you know how to get in touch there as well. So thank you so much, Kate, for joining us and answering questions. We're really looking forward to seeing you graduate, and you've got lots of good experiences from TAFE. So thank you so much.
Thanks, Sarah.
Perfect. So we'll move on to a little bit of information about the course. I will unspotlight Kate's face and share my screen for us. There's a little bit of information about the Diploma of Nursing. The Diploma of Nursing that we offer at GoTAFE is the course that you need to complete in order to register with our governing body called APRA to be able to be working as an enrolled nurse in Australia. We have 2 intake offerings at our campuses, and they come in a full-time component, which is a 2-year course studying 3 days a year. And we have a part-time component, which is a 2-day-a-week course for 2.5 years. So that means if you start in our July intake, our full-time intake will finish in July 2025, pending placement availabilities, and our part-time intake will finish in December 2025, pending placement availabilities. The course is delivered primarily face-to-face in classrooms and the clinical lab space where you do a lot of the theory and practical components, but there is some online component to it. All of our learning content and assessment materials and things like that are submitted through an online portal. So we really do encourage digital literacy, and we have some support to help with that as well. We've also got clinical placements, which we'll touch on shortly. So we have some requirements for the Diploma of Nursing. The first one is that you are required to be over 18 years of age. You also are required to obtain a working with children's check, a national police check, an NDIS screening. You need to have a full immunisation history and complete your BKSB. If you haven't done more than 6 years of schooling in Australia, with a certain amount of those being in high school, please touch base with the engagement officer that you're talking to, because you will be required to do an English language test as well. We also require teamwork and time management skills, a good level of fitness, because you need to be able to kneel down, do 2 minutes of consecutive CPR. You need to be able to move patients around and assist with mobilization. So we do require good fitness level and general health. You need to be able to have the requirements to complete practical placement, and most importantly, a desire to commit to the course. Following completion of the course, as I said before, you can then register with our governing body, which is called APRA. This requires yearly registration, and you need to have finished the Diploma of Nursing to be registered as an enrolled nurse. We're taking intakes at 4 different campuses this July, so I'll leave this up for a little bit. Shepparton, we're taking 2 intakes, a full-time and a part-time intake. As said before, full-time is 3 days, part-time is 2 days. Our Shepparton campus full-time will be running Wednesday, Thursdays and Fridays, and our part-time will be Tuesdays and Fridays. Our Seymour campus is taking 1 intake, a full-time intake, 3 days a week, Wednesday, Thursday and Friday. Wangaratta, we've got 2 intakes, a full-time and a part-time. Full-time at Wangaratta is Wednesday, Thursday and Friday, and the part-time is Monday and Tuesday. And then our Benalla campus is taking 1 intake, a part-time intake, and that will be Tuesdays and Wednesdays. So again, full-time is 2 years, part-time is 2.5 years. Orientations will be at the respective campuses. So Shepparton intakes will do orientation at Shepparton campus. Seymour will do it at Seymour. Wangaratta will do it at Wangaratta, and Benalla will complete Monday orientation at Wangaratta and Tuesday in Benalla. Orientation program is Monday the 10th of July and Tuesday the 11th of July. Now, I know that some of the days of operation for you are not a Monday and a Tuesday. This will be the only time in the course that we do ask you to come in on a day that is not a day of operation for orientation. We have attendance requirements in nursing. It's required that you complete 80 or attend 80% of your theory classes. So those are your in-classroom classes. 100% of your clinical labs, where you're learning all the practical skills, like how to take blood pressure and how to do ECGs, which are tracings of the heart conductions, and then also 100% attendance at placements. Unfortunately, if you cannot meet these attendance requirements, you will need to repeat the unit. Placement, we do 4 blocks of placement. So 4 different placements you'll go on, and they equal 11 weeks. So the first placement you go on is typically an aged care placement. This is in a nursing home or an aged care facility, and that one's 2 weeks. If you're in the full-time intake, that is 6 months into the course. If you're in the part-time intake, it's about 9 months into your course. The following placement is our primary healthcare placement. Now, this one can be in district nursing, can be in a health promotion kind of facility, or it can be in a place like mental health facility. These are all those front-facing kind of preventative placements. So this one is a 2-week block, and that is usually at the end of the first year for full-time, and about a year and 3 months for part-time intakes. The third placement is our acute placement. So this is when you get to go into a hospital setting. It's usually subacute, so either small regional hospitals or rehab facilities. And this is where you're really consolidating all those acute skills you're learning in TAFE. This is a 3-week block. And that is at the end of the 18-month mark for the full-timers and about the same time for the part-timers. The final placement, this is your last placement you go on until we send you out into the real world as a nurse. This is a 4-week placement and it is an acute placement as well. And this is where you get put in a more kind of surgical medical ward. You can float into theatre if that's something that interests you. And that's your final 4-week block at the end of the 2 and 2.5 year mark, respectively. For practical placement, you will be put in places in Victoria, but unfortunately we cannot guarantee local to you. We try our best, as Kate said, you know, she got a placement that was 20 minutes from home, another one that was half an hour, Cobram's an hour from Wang, and one that is in Wangaratta, so she's really lucky there. But at times, students may need to travel for placement. You may be a Seymour student who's placed in Cobram. In situations like that, accommodation costs are at the expense of yourself. There are some funding and grants out there, usually can cover for 4th placement at times, and hospitals do have subsidised accommodation, so some hospitals will offer like $10 a night hospital facility accommodation, and that's some stuff you can talk to the placement team about getting a bit more advice on if your placement provider offers that. As I said before, placement has a 100% attendance requirement, and if there is a non-attendance for one of those days for a reason that is not acceptable, so you just don't feel like going, or your alarm didn't ring, then it's a $65 a day fee. But with that said, we are understanding of situations. So if you've woken up feeling unwell, of course, we're going to encourage you to stay home. And in that case, that fee is not put on to you. Shift allocations for placement, they do run at a full-time kind of situation. So even if you're a part-time student or a full-time student, you're expected to go on placement for 5 days a week. At some hospital placement providers, this can include weekends. The shifts though are AM shifts, so generally 7 till 3:30, and PM shifts, which is about 1 or 1:30 till 9:30, 10. In order to meet our placement requirements, so to go on placement, you do need a police check from the calendar year. I know that said the last 12 months, I apologize, it needs to be from the calendar year. So if you're going on placement in April and you had a placement in November and you had a November police check, you need to get a new one for that year, but it will last for the whole year. So if you're doing placement in 2024, you need a 2024 police check. You'll also need a working with children's check. Now, if you don't already have one, you can just get a volunteer version of it, which is free of charge. You're allowed to utilize your working with children's check volunteer for placements. You need to get an NDIS check. You need to have all your pre-placement immunizations and serology evidence. So this is evidence of Hep B vaccination, measles, mumps, and rubella. You need a flu vax from every year that you're going on placement. So obviously for this year, you need a 2023 one. For next year, you'll need a 2024 flu vaccination. And we require our students to be fully COVID vaccinated. So that's 2 and a booster, 3 vaccinations at a minimum. In addition, you'll need to declare that you are fit for practice, and you need to have your first aid certificate with yearly CPR refreshers. At GoTAFE, first aid is offered as a unit in the Diploma of Nursing. So you will complete that with us free of charge. But following that, your yearly CPR refresher is at the cost of you. We do offer it at GoTAFE, but it is at a cost of $65. These are the course fees. You may be eligible for free TAFE. Have a discussion with your engagement officer to assess eligibility. But if you're not, the full fee for service is $26,370. On top of free TAFE, when we talk about free TAFE, it doesn't mean everything is free. It just means that your course is free. So there are some additional costs on top of the course cost or the course fee that you will be required to pay. So our uniforms are about $200. A set of navy scrubs runs at about $75 at the moment. We do encourage you to have 2 because on placements, if you're wearing it every day, you probably spend more in your dryer bill. Textbooks, they can run at $1,000 if you like hard copies. However, we do offer an online textbook program at GoTAFE where you have free access to textbooks on a digital platform. With that said, there are 1 or 2 books you will be required to have in paper hard copy. We will give you a book list upon enrolment. Immunizations and evidence of other vaccinations. So if you don't already have your vaccinations, you will have to pay for the cost of getting vaccines and the administration cost, and serology blood tests if you're not eligible for bulk billing on those. Something to really keep in mind here is you would have seen the bulk billing doctors is decreasing and the doctor fees GPs is increasing. So a cost to keep in mind is that you will have to pay doctor fees potentially every time you need to go and get serology. So try and streamline that at once. In addition, a Victorian police check, we subsidise the cost of that. I think it ends up being something like $20. Working with Children's check, which is free of charge for volunteer, and an NDIS check, which is about $160. And as I said before, your yearly CPR update is about $65. You're not obliged to get it through GoTAFE, but you do have to provide it to the placement team every 12 months. As Kate touched on before, we do have some support services at GoTAFE. We're really lucky to have a great student success team who can help with learning support. They can help with wellbeing, counselling, and we do offer things like laptop loans, where if you can't secure a laptop at the moment, you can loan one at a fee from the TAFE as well. We also run something called Scrub Club at our campuses, which is essentially just a tutoring group after school once or twice a week, depending on where you are. And that has a nursing trainer and a learning support officer in there. So you can go through any assessment requirements or any questions, practice any medication calculations or anything like that. Some frequently asked questions that we get: if I have a police conviction, can I do the course? The short answer to that is yes. You can potentially. A police conviction isn't going to exclude you from the course, but it really depends what it is. If, for example, you drove without a license in 1984, a placement provider is not going to look at that and go, well, that's high risk behaviour. But if you have a conviction, please talk to us about it, because a placement provider might not place you, and therefore we wouldn't be able to give you a spot in the course because you cannot complete the placement requirements, which means you cannot finish the course. So it's really important, if you have any conviction, whether it's a 1984 driving without a license or a 2022 assault charge, please come to us and we can give you more of the information on that. Can I get credits for prior qualifications? Yes, if the course code is exactly the same. So some really common ones we see are our work health and safety, if you've done another course, our working with diverse people. If you've done the exact same unit, we can give you what we call a credit transfer, which means you won't have to complete that again. So if you've done any prior qualifications, let your engagement officer know, and they can compare course codes to see if we've got any credit transfers there. Where can I access a computer? You will be required to bring a laptop on campus every class. As I said, our learning materials are online. We submit our assessments. We do our assessments digitally. So if you don't already have one, you can talk to our student success team and we can help you with the laptop loan. Do I have to satisfy a fitness requirement? Yes. You need to declare that you are fit for practice. If this is in question at any time, we can ask you to go get your fit for practice signed by your GP. And what pathways are available after completing this qualification? So after you do your Diploma of Nursing, you can pathway into the Bachelor of Nursing at we have partnerships with CSU, Charles Sturt University, and La Trobe, and this makes your registered nursing course, which is normally 3 years, a 2-year course. Now, it's important to keep in mind that industry now, so that industry is our hospital providers and things like that, do offer a lot of scholarships, and the government do subsidise moving into registered nursing. So keep in touch with the coordinators and your trainers and partnerships along the way of your course, and you might find that they'll give you some good advice on how to pursue a Bachelor of Nursing course if it's something that interests you.